The body is very good at fighting off foreign objects. Usually this is a good thing. It prevents you from getting sick every time someone coughs on you. However, there are select cases where this is not so useful, such as if someone's received a lung transplantation. The body sees the transplanted lung as being foreign and thus tries to attack it. This is why people who've received lung transplants need to be on immune-suppressing medications. This is also why we do testing to ensure that a recipient and a donor are well matched. To use an analogy, when someone needs a blood transfusion, we determine the blood type of the recipient with two major groupings, the blood type of the donor, and test for any antibody-related reactions. For example, if I were to receive a blood transfusion, my blood type is B positive. Therefore, it would be easiest to receive blood from someone who's also B positive. Similar theory can be applied to lung transplantation. There are just more groupings. So looking at our example slide, we have a potential recipient and a potential donor. If we look only at their typing, they're very well matched, nearly identical other than at one of the B alleles. Next, we look at the antibodies a recipient has. Unfortunately, this recipient has antibodies to B13, which is one of the alleles that the potential donor has. This is known as donor-specific antibodies, or DSA for short. Classically, this recipient wouldn't receive that potential donor lung because the risk of complications is increased when there are known DSA. However, as immune-suppressing therapies have improved and the need for transplants has increased, there arose a question as to whether we could safely transplant someone despite DSA. This is where our research project comes to play. At the University of Alberta, the lung transplant team has been using different techniques to suppress the immune system and thus transplant someone with DSA. We wanted to know if the survival and immune-related complications were similar between patients who had no DSA and received a transplant versus those who had DSA and thus received additional special treatments. Our results show that the survival is comparable between these two groups. This is important because it broadens the possibilities of what recipient could receive which lung transplantation. It also allows us to further respect the donors by ensuring that their generous donation makes a positive change. Thank you.